So the diagnosis, treatment, and beyond treatment outlook, survival of patients with lung cancer has changed rapidly. And it's almost breathtaking to see the speed of that change. So, for example, previously, most patients who had lung cancer came in because they had symptoms. I was coughing, I coughed up blood, I'd been losing weight, I had some pain somewhere. And typically by the time we identified that this was lung cancer, well, it was a cancer that was here, there, everywhere. You fast forward to the National Lung Screening Trial, which basically asked the question, patients who are at risk for lung cancer, who are beyond a certain age, 55 and above, who have smoked a certain amount in their life, who are either active smokers or if they quit, have done so within the past 15 years, but who all look healthy and have no symptoms. Doing a CAT scan once a year for 3 years on these patients suddenly allowed such a high level of detection at such a small size of the cancer, well before any of them had symptoms, that it translated into a significant survival benefit. That's an example of emerging knowledge, technology that is making a big difference for our patients. And it speaks a little bit to the challenge we still have in front of us, which is how to open this up to all the people who are at risk out there who could benefit from it. So that's at the early end, detecting and diagnosing. And then you go all the way to the identification of so-called gene mutations in oncogene-addicted lung cancers, meaning these are lung cancers that are driven by a specific identifiable difference in the genetic makeup of those cells themselves, for which there is a specific drug that targets that abnormality and makes the cancer sort of shrink away, shrivel away, without scorching the earth as chemotherapy did. And then, of course, one has to talk about immunotherapy, which is the big excitement we all have. Teaching the patient's immune system how to recognize the presence of the alien cancer cells and, more importantly, fight. So patients have, for time immemorial, asked, is there something I could do to boost my immune system to help me fight this cancer? Well, finally, after many decades of trying and saying no, the answer is yes. So we're excited.